Hello, everyone. This is Bob Browner with Coronavirus Update number 4, and the theme for today is to keep calm and don't panic. A lot of us in public health have been raising the alarm for weeks now and trying to get the attention of everybody, and I think we've basically got everybody's attention. Everybody is now responding in what I think is an appropriate manner nationally across the country. Unfortunately, I think there's a few folks this last week are overreacting, and so the theme for today is keep calm. We do not need to overreact and panic. The numbers still are the same. I think we still don't know what our case fatality rate is going to be or how widespread things are. Yes, the range here in Lincoln, Nebraska could be a death rate of 500 up to 5,000, which sounds like a lot. I do think some things have been happening in the last week or two that actually will hopefully push us more toward this end rather than this end, maybe even lower if we got it all right and we got it all on time. So some things happened, of course. Lincoln Public Schools is closed indefinitely, as are universities, and pretty much across the country this is what happened. It's been fascinating to me that where has the public health leadership come from in the country? It's not come from the typical government public health areas other than the epidemiologists who've been trying to get everyone to pay attention. Actually, as universities and public schools are the first ones to take this seriously, I think, and lead in their communities despite taking some flack. Interestingly enough, one of our best public health leaders in the last few weeks, actually, I would say, is the NBA and the NCAA for closing down the tournaments when they did. That may have made a huge difference, and they did so with great risk, lost a lot of money, but really did the right thing. So you never know when your leadership's going to come from, and who would have guessed that the NBA and the NCAA would be some of our best public health leaders in the U.S. Here this last few weeks, as well as universities and public schools. I guess I'm not surprised at them. They're educators. They're pretty smart. So the question now, of course, is will all of us across the country look more like Philadelphia or more like St. Louis? I think the odds are now swaying more toward the St. Louis response. It will probably, of course, just like back 100 years ago, vary from community to community. Unfortunately, when you're in the urban center on the edge, things hit you first. And so Philadelphia could be like that just because of their location, and those in the middle of the country more like St. Louis. But I think collectively, a lot of folks have do a good job of closing down the schools and social distancing. So hopefully we got on this on time. And again, just like the prior updates about flattening the curve, hopefully we got to the point where we slowed things down enough that we will not overwhelm our healthcare system. And so I think our odds are getting better and better that we're more on this side. Hopefully we did so in time. We won't know where we are because we don't have widespread testing yet. This is probably my biggest disappointment as a public health person is how far behind we were as a country with being able to do testing. I've heard that South Korea has been doing able to do 15,000 tests a day. I think that's all we've done in the last couple of months. Hopefully this will be ramping up soon and then we'll have a better understanding what's going on with the epidemic. The most thing I want to emphasize more is I think some folks are overreacting a little bit. Steps 1 and 2 of the NPIs are about social isolation. That's if you're sick or somebody in your house is sick. It is not about social isolation, though, however, if you're in a healthy environment. We've already done a good job of closing down our schools so that people aren't mixing about. But I want to emphasize more than anything else, social distancing is not social isolation. So if you are healthy, it's social distancing, not social isolation, and it's really avoiding socially dense situations, not all social situations. So I think some folks maybe are pushing it back a little too far. You can still talk to people, you can still meet people, just don't hug and kiss them. But you need to maintain your distance, but it doesn't mean you can't get out socially. So it's important, especially because social isolation for some people is just as dangerous as coronavirus. So last time I talked about Tamara and Grandma Fern, who are now YouTube stars with a dance and visit. This is Mary Jo, one of my coworkers visiting her mom. We need to make sure, yes, there is some isolation precautions with the window here, but we do not want to be socially distanced from people because people need that social interaction. We are social animals. Keep up the funny Facebook posts. A lot. This is our favorite one from yesterday. I've seen some really inspiring stuff. So this by Tom Green about him social distancing and actually some reasons to be grateful in all this. And lastly, most importantly, I grew up watching Mr. Rogers as a kid. This is probably one of the most, I think, famous videos. So if you Google that and watch him talking about looking for the helpers, there are a lot of helpers. And one perspective I've told people lately is literally we closed Lincoln Public Schools that may actually closing Lincoln Public Schools may actually be a net harm to the kids because they're not receiving education. Some young families may be needing food, and it's going to be harder for them to get food. Although we've done a good job of figuring out how to do alternate ways of delivering meals. Special education kids are going to have a hard time getting some of the special education they need, although we'll do your best. They're doing that for you. They're doing that to protect the health of the public. And so keep in mind, you may feel a little anxious right now, but how many people are sacrificing to make things better for everybody else in the community? Consider care workers, for example. Healthcare workers, unfortunately, are high risk because their exposure could be higher than others. They will potentially get sick by this as well, but they're still showing up to work and they're still going to be there for you. My wife Lisa is still seeing patients. My brother-in-law Dave is still working at the lab at the hospital. I have cousins who are nurses. They're still going to be there. I have another colleague. He's 65 years old with heart disease. He's got his affairs in order. He's planning to show up work even though he knows that if things got toward the worst, it could be his death. He's doing that anyway, and he's doing it for you. So you guys need to make sure you're following the rules and helping along with this, because you need to give back in return. So the good news is that I do see a lot of people doing great things right now, and that actually is quite uplifting. The other thing you need to think about is how to access the healthcare system. So this is the clinic on the other side of our building. Some folks that I work with, here's them. What they need to do is they need to not have you showing up to the clinic if you're sick. They still have to do primary care for other things. Kids still need vaccinations. Pregnant women need to be seen. People with heart failure and diabetes need to be seen. When I stopped by and took this picture of them, there was a little boy who'd fallen down the stairs and was cradling his arm. He needs his arm x-rayed. We need to make sure that you, if you are sick, are not mixing with them. So almost all clinics have this sign says stop, go back to your car if you're feeling sick, and call. They'll come out to you and give you directions on what you need to do. Don't go stomping in the clinic if you think you might have coronavirus, because you might infect everybody else. They've limited protective equipment supplies. Do not be wasting their equipment if you don't have to. So call and ask first. Don't go stomping into the clinic or the emergency room or the urgent care center if you think you have coronavirus. Keep in mind, 80% of people with coronavirus will have mild infections. All they're going to need to do is rest, stay hydrated, and maybe take some acetaminophen, and they will be just fine in a week. Symptoms, if you're unsure, it's fever, cough, shortness of breath, and sore throat. Those are the main symptoms of someone who has coronavirus. If you have a mild infection, there is no need to call your doctor. There is no need to get tested. Just stay home so you're not spreading it to everybody else. And that includes everyone in your house, because if you have it, there's a good chance your family members have it or will soon have it. So that's when you need to social isolate. If you're worse, then call your primary care doctor. It's basically the people that are trouble breathing because they run out of oxygen. Those are the people that need hospitalized. They need supplemental oxygen, those kind of things. Healthcare needs to focus on those sick people, not people like this. So make sure that you're using healthcare judiciously. It's on you to do the right thing. And adjust to the new normal. So my wife and I thought we were empty nesters, but not again. We're gonna have a full house again. My daughter studying her online class, and I got a bonus. Her roommate didn't have a place to stay, so we're gonna actually have extra people in our house shortly. Walking to work today, it says the signs of spring. It was actually a nice day. It smelled like spring. The birds were chirping, but it may get hard. I like this post. One of my friends sent this to me. You're going to have to work at home. The kids are going to be gnarly at times. Maybe kick them out, get them out running around. Boy, a lot of parents. I have a cousin who's a special ed teacher, but now she's at home having to homeschool her own kids. It's actually harder to homeschool your own kids than somebody else, and so a lot of good posts on that. So one of the benefits I've found is that social media for me right now is a lot more fun, because I've had so many people sending really good, uplifting and funny things on social media. So for those of you who do that, keep that up, and drop the negative and the snarky stuff. So again, the simple rules: if you're sick, stay home as long as you. Everything else we're working on, we just covered social distancing, not social isolation, not socially away at all. Basically, avoid socially dense. We're kind of hunkered down probably for 2 to 3 weeks until we can get widespread testing up and running. Hopefully this will be coming soon. And that's pretty much it for today. So hopefully that was helpful to you all, and I'll probably send out another update in a few days. I think we'll know more based on when we get more testing.